Have you ever woken up in the morning and felt your knees stiff, your back tight, or your shoulders aching before your day even begins? If you're over 50, you're not alone. In fact, more than 70 million Americans experience chronic joint pain from arthritis, osteoarthritis, or long-term inflammation. And for many, it starts quietly. One day, it's a little stiffness when climbing stairs. Then a few months later, it's pain that keeps you from walking around the block. But here's the truth that many people misunderstand. Joint pain is not just a normal part of aging. It's a signal, a message from your body that something deeper is changing inside your bones, muscles, and connective tissues. And if you ignore that message, the consequences go far beyond pain. It can affect your balance, your mobility, your independence, even your heart and brain health. As a health expert specializing in chronic conditions among older adults in the United States, I've seen hundreds of patients fall into the same trap. They assume pain means getting old. But biology says otherwise. The pain we feel after 50 isn't simply about time passing. It's about inflammation, nutrition, hormones, and lifestyle choices that either protect or damage our joints every single day. So in this comprehensive guide, we'll explore, in plain, science-backed terms, what truly happens to your joints after 50, what causes chronic pain, how to prevent further damage, and what proven treatments are changing the way Americans age today. Let's begin with the foundation, understanding what joint pain after 50 really means. The role of joints, the hidden architecture of movement. Your joints are not just hinges. They are complex living systems. Each joint, whether it's your knee, shoulder, hip, or spine, is a masterpiece of biology designed for motion, flexibility, and shock absorption. They're made up of bones that meet at a point, cushioned by cartilage, lubricated by synovial fluid, and supported by muscles, ligaments, and tendons. When we are young, these systems work in perfect harmony. But over time, that harmony begins to fade. Cartilage thins, collagen breaks down, and the production of synovial fluid slows. The result? Friction increases, mobility decreases, and inflammation becomes chronic. The small aches you ignore in your 40s can evolve into disabling pain in your 60s. Understanding this structure helps us see why joint pain isn't just about wear and tear. It's a systemic issue involving metabolism, inflammation, and even immune function, aging, and cartilage. Degeneration, why time alone isn't the enemy. Cartilage, that smooth, rubbery tissue that cushions your joints, doesn't regenerate easily. After your 40s, your body's ability to repair it drops sharply due to declining collagen synthesis and reduced blood flow to the joint capsule. However, aging itself isn't the main villain. Lifestyle factors, poor diet, sedentary habits, obesity, and chronic inflammation accelerate cartilage damage. In the US, osteoarthritis affects nearly 1 in 6 adults over 50, and studies from Harvard Medical School show that modifiable factors, not age alone, account for over 60% of the degeneration rate. That means you can slow it down. Exercise that strengthens surrounding muscles, foods rich in omega-3s, vitamin D, and collagen supplements all help your joints maintain resilience. Aging and cartilage degeneration. Why time alone isn't the enemy. Cartilage, that smooth, rubbery tissue that cushions your joints, doesn't regenerate easily. After your 40s, your body's ability to repair it drops sharply due to declining collagen synthesis and reduced blood flow to the joint capsule. However, aging itself isn't the main villain. Lifestyle factors, poor diet, sedentary habits, obesity and chronic inflammation accelerate cartilage damage. In the US, osteoarthritis affects nearly 1 in 6 adults over 50, and studies from Harvard Medical School show that modifiable factors, not age alone, account for over 60% of the degeneration rate. That means you can slow it down. Exercise that strengthens surrounding muscles, foods rich in omega-3s, vitamin D, and collagen supplements all help your joints maintain resilience. The inflammation connection. When the body turns against itself, inflammation is the body's natural defense. But when it becomes chronic, it destroys instead of heals. In people over 50, chronic low-grade inflammation, often called inflammaging, becomes a silent killer of joints. Cytokines, free radicals, and enzymes like MMPs, matrix metalloproteinases, attack the collagen and cartilage that keep joints flexible. This process isn't always painful at first. Many Americans walk around for years with silent inflammation until pain, stiffness, or swelling suddenly appears. Chronic stress, processed foods, smoking and poor sleep all fan the inflammatory fire. Reducing this inflammation is key through nutrition, movement, and targeted supplementation, not just painkillers. Osteoarthritis versus rheumatoid arthritis, two very different enemies. Osteoarthritis, OA, and rheumatoid arthritis, RA, are often confused, but they're completely different. OA is a degenerative condition, a mechanical breakdown of cartilage over time. RA, on the other hand, is autoimmune. Your immune system mistakenly attacks your own joints. RA affects about 1.3 million Americans, mostly women over 50, and it can cause fatigue, fever, and joint deformity if untreated. OA, meanwhile, is far more common. It's the wear and tear arthritis seen in the hips, knees, and spine. Understanding which one you have matters enormously because the treatment pathways differ. OA needs mechanical and nutritional support, while RA requires immune modulation and medical supervision. Hormonal changes and joint health. Why women are more at risk. After menopause, estrogen levels drop sharply, and estrogen plays a crucial role in maintaining collagen, bone density, and joint lubrication. That's why women over 50 often experience more joint pain than men. Research from the American College of Rheumatology shows that estrogen helps suppress inflammation and supports synovial fluid production. The loss of estrogen leads to stiffness, cracking joints, and faster cartilage breakdown. Hormone replacement therapy, HRT, when appropriate and medically supervised, has shown benefits for some postmenopausal women. However, natural support, like phytoestrogens, found in soy, flaxseed, legumes, and anti-inflammatory foods, can also play a protective role. Inflammation, the silent fire, inside your joints. When people over 50 complain about stiffness or aching joints, the real culprit isn't just old age. It's chronic inflammation. This kind of inflammation is different from the acute swelling you feel after an injury. It's subtle, ongoing, and fueled by lifestyle factors that many Americans experience daily. Processed food, high sugar intake, lack of movement, and stress. As we age, our immune system becomes less efficient at distinguishing between real threats and our own cells. This phenomenon, known as inflammaging, causes the immune system to release inflammatory molecules like cytokines and interleukins, which slowly erode cartilage and joint tissue. Over time, this creates a cycle. Inflammation causes pain. Pain limits movement. Less movement increases inflammation. The American Journal of Clinical Nutrition has shown that diets high in refined carbohydrates, fried foods, and trans fats raise inflammatory markers like C-reactive protein, or CRP. Meanwhile, anti-inflammatory diets, rich in omega-3 fatty acids, turmeric, ginger, and leafy greens, lower CRP and IL-6 levels significantly. The takeaway? If your diet is full of sugar, soda, and processed snacks, your joints are paying the price. Chronic inflammation is not inevitable. It's a direct response to the way we live, eat, and manage stress after 50, muscle loss, and sedentary lifestyle. The new smoking of aging. After the age of 50, the average American loses 1 to 2% of muscle mass per year, a condition known as sarcopenia. This loss doesn't just make you weaker, it directly affects your joint stability. Joints rely on muscles for support, alignment, and shock absorption. When those muscles weaken, the joints bear more pressure, leading to microdamage and pain. A sedentary lifestyle compounds this problem. According to the CDC, over 60% of adults over 50 fail to meet the minimum physical activity guidelines. Sitting for hours daily reduces the blood circulation to the joints, depriving cartilage of oxygen and nutrients. Over time, the cartilage dries out, leading to stiffness and reduced flexibility, especially in the knees, hips, and lower back. In clinical studies from the Mayo Clinic, patients who performed even moderate resistance training twice a week improved joint function and pain scores by over 40%. The reason? Exercise increases synovial fluid production, the natural lubricant inside your joints, and triggers anti-inflammatory myokines from muscles. Movement is medicine. A strong body protects weak joints. For people over 50, gentle weight training, yoga, and swimming aren't optional luxuries. They are essential prescriptions for joint longevity, hormonal and metabolic changes. When your body's chemistry shifts as people reach their 50s, hormonal balance begins to change dramatically. For women, the drop in estrogen after menopause accelerates the breakdown of collagen, a vital protein for cartilage and joint elasticity. For men, testosterone levels decline steadily, which affects muscle repair and bone density. Both hormones play indirect but powerful roles in joint integrity. Metabolism also slows with age, making it easier to gain fat and harder to maintain lean muscle. Excess body fat doesn't just add weight to your knees, it acts as an active endocrine organ, releasing pro-inflammatory molecules called adipokines. These chemicals amplify systemic inflammation, worsening joint pain and stiffness. A 2021 study from Johns Hopkins University revealed that obese adults over 50 were up to 4 times more likely to develop knee osteoarthritis than those with a healthy weight. Additionally, insulin resistance, a common feature of metabolic syndrome, further damages cartilage by reducing nutrient absorption and increasing oxidative stress. Addressing these hormonal and metabolic changes means more than just losing weight. It means rebalancing the body through whole foods, stable blood sugar, quality sleep, and targeted supplementation like vitamin D3, magnesium, and omega-3s. Hormonal aging is inevitable, but the suffering it causes doesn't have to be. Nutritional deficiencies. When your diet slowly destroys your joints. Even in the wealthiest country on earth, nutritional deficiencies are surprisingly common among adults over 50. The standard American diet, high in calories but low in micronutrients, deprives the joints of the building blocks they need to regenerate. Key nutrients, such as collagen and peptides, vitamin D, calcium, omega-3s, and magnesium, are essential for maintaining cartilage structure and reducing inflammation. Without enough vitamin D, calcium cannot be absorbed properly, leading to weak bones and fragile joint connections. According to the NIH, about 40% of Americans over 50 have insufficient vitamin D levels, especially during winter months. Omega-3 deficiency, meanwhile, reduces anti-inflammatory signaling, allowing chronic inflammation to thrive unchecked. Collagen, glucosamine, and chondroitin sulfate are other vital nutrients that form the scaffolding of joint cartilage. While the body can produce them naturally, production declines sharply after 40. Supplementation, when combined with protein-rich foods and vitamin C, has been shown to slow cartilage degradation in clinical trials. Nutrition is not just about avoiding pain, it's about rebuilding your body from within. A well-fed joint is a stronger, more resilient joint. Every meal is either healing your inflammation or feeding it. Overuse, injuries, and biomechanical stress. The forgotten factor many adults assume joint pain comes from aging alone. But often the real reason lies in years of small, repeated biomechanical stress. Poor posture, improper lifting, repetitive movements, or even old sports injuries can quietly damage joints over decades. These micro-injuries create scar tissue, disrupt alignment, and cause uneven wear on cartilage surfaces. For example, prolonged sitting causes tight hip flexors and weak gluteal muscles, shifting pressure onto the knees. Poor foot alignment, such as flat arches, can lead to chronic ankle and knee pain. Even sleeping on the wrong mattress or using improper footwear can gradually distort the body's biomechanics. Physical therapists in the US emphasize that most joint problems after 50 are mechanical before they are medical. Addressing posture, alignment, and flexibility can dramatically reduce pain without medication. Techniques like myofascial release, Pilates, resistance bands, and balance training correct the underlying patterns that cause joint overload. Prevention starts with awareness. How you move, sit, and stand today predicts how your joints will feel 10 years from now. Treat your body mechanics with the same attention you give to diet, because movement patterns are as powerful as nutrients in determining your joint health future. Joint pain over 50 is not caused by one single factor. It's the result of inflammation, muscle loss, hormonal imbalance, nutritional deficiencies, and years of poor mechanics combining into one vicious cycle. The good news is that each of these can be reversed or managed with lifestyle science, if you act early. Early warning signs and common misconceptions. Morning stiffness, the first red flag. Most people ignore. If you wake up in the morning and it takes more than 15 minutes for your joints to loosen up, that's not just a sign of aging. It's an early warning of inflammation inside your joints. Healthy joints, even in your 50s or 60s, should feel flexible and ready to move after a brief stretch. But when the cartilage and synovial fluid are under inflammatory stress, the joints stiffen overnight, and you feel that dull ache the moment you stand up. According to the Arthritis Foundation, persistent morning stiffness lasting more than 30 minutes is a hallmark symptom of arthritis, particularly osteoarthritis or rheumatoid arthritis. The cause isn't just the loss of cartilage, it's also the reduced circulation and stagnation of synovial fluid while you sleep. Many Americans overlook this because it's gradual. One morning you feel a little tight. Then a month later, you're avoiding stairs or bending down. That's the trap. Joint pain creeps in silently. The key is early action. Gentle morning stretches, hydration, and omega-3-rich breakfasts can dramatically improve joint fluidity. If stiffness becomes routine, don't ignore it. It's your body's whisper before it starts screaming. Swelling, warmth, and tenderness, the inflammation you can feel. When joints feel warm to the touch, mildly swollen, or tender after mild activity, that's inflammation at work. This physical warmth comes from increased blood flow and immune activity inside the joint capsule. It might look subtle, your knee looks slightly puffier than usual, or your ring feels tighter, but these are critical signals. In clinical practice, we call this low-grade synovitis, the swelling of the joint lining caused by chronic immune activation. For adults over 50, it's one of the most common precursors to arthritis. The swelling doesn't always mean severe disease. It's the immune system's overreaction to wear, tear, or even dietary inflammation. One study from Harvard Medical School found that patients who ignored minor swelling for more than a year were twice as likely to experience joint damage visible on MRI scans. The reason? Chronic swelling disrupts the joint's mechanical balance, leading to uneven cartilage wear. If you notice consistent swelling or warmth in your knees, hands, or ankles, even without sharp pain, it's time for evaluation. Early detection allows targeted lifestyle and medical intervention, preventing decades of damage. Fatigue and invisible symptoms when your energy declines. First, many patients in their 50s and 60s don't connect fatigue, poor sleep, or brain fog to their joint pain, but they are deeply connected. Chronic inflammation doesn't just affect the joints. It releases cytokines that travel through the bloodstream and impact the brain and energy metabolism. This is why people with arthritis often feel tired even before they experience severe pain. In fact, rheumatologists at Johns Hopkins note that fatigue is one of the earliest and most under-recognized symptoms of systemic arthritis. Your immune system is overactive, your sleep quality declines, and your muscles become weaker, forcing the joints to bear extra load. This energy drain often makes people less active, which worsens stiffness and inflammation, a vicious cycle. Breaking that cycle requires not only physical care, but metabolic support, anti-inflammatory nutrition, better sleep hygiene, hydration, and low-intensity movement such as walking or Tai Chi. So if you're feeling unusually tired or sluggish and your joints ache even mildly, pay attention. Your energy decline might not be normal aging. It could be inflammation whispering from within. Misconception 1. Joint pain is just a normal part of aging. This is the biggest myth in American aging culture. While joint wear happens naturally, chronic pain is not inevitable. Studies from the National Institutes of Health, NIH, show that up to 50% of adults over 50 experience preventable joint pain, meaning lifestyle, not age, is the true driver. Cartilage can degrade over time, yes, but its rate depends on modifiable factors: diet, activity level, body weight, and inflammation. In regions like Okinawa or Sardinia, known for longevity, older adults stay mobile into their 80s because of anti-inflammatory diets, daily movement, and low stress. The American lifestyle, in contrast, promotes joint inflammation through inactivity and poor nutrition. Aging is a risk factor, not a sentence. Your body is dynamic. It rebuilds daily if given the right inputs. The sooner people reject this myth, the faster they can act. Through strength training, mobility exercises, and nutrition to protect their joints for decades ahead. Misconception number 2, painkillers are the solution. In the US, over-the-counter pain relievers like ibuprofen or acetaminophen are used daily by millions of older adults. While they help short-term pain, they often become a crutch that masks deeper issues. Painkillers don't treat inflammation, they silence symptoms. Prolonged use can harm the liver, kidneys, or digestive system, and make the problem worse once you stop. The Centers for Disease Control and Prevention, CDC, warns that long-term NSAID use, like ibuprofen, can increase cardiovascular risks and gastrointestinal bleeding, especially in adults over 60. Yet many continue to use them because they believe it's the only option. A better approach is multimodal care, combining physical therapy, anti-inflammatory foods, safe supplements like turmeric or boswellia, and strength training. These methods address root causes instead of merely suppressing pain signals. Pain is a teacher, not an enemy. If we only silence it, we miss the opportunity to correct what's causing it. True healing requires understanding, not just medication. Misconception number 3, if it's not swollen, it's not serious. Many people believe joint pain only matters when swelling or redness is visible. In reality, internal degeneration often occurs without external symptoms. By the time swelling appears, cartilage damage may already be advanced. This is especially true for weight-bearing joints, like the hips and knees. MRIs of middle-aged adults show that nearly 1/3 of people with cartilage thinning report no pain or swelling at all. Their pain often begins months or years later when the damage has become irreversible. The absence of swelling doesn't mean the absence of disease. Cartilage has no nerves, so early breakdown is painless. What you feel as a little stiffness may already represent years of micro-damage. That's why routine checkups, especially imaging and blood work, are essential for those over 50. Early detection allows conservative treatments like physical therapy and supplements before surgery or joint replacement becomes necessary. Misconception number 4. Exercise makes joint pain worse. This belief keeps millions trapped in chronic pain. When joints hurt, people often avoid movement out of fear of making it worse. But the opposite is true. Lack of movement weakens muscles, reduces circulation, and allows inflammation to settle deeper. According to the Arthritis Foundation, low-impact exercises such as swimming, yoga, resistance bands, or brisk walking actually improve pain and stiffness by 30 to 50% in most patients. The key is choosing the right kind of movement, controlled, consistent, and guided by professionals if needed. Exercise increases the production of synovial fluid, strengthens the muscles supporting the joints, and improves balance, reducing the risk of falls. Think of it as joint nutrition through motion. So if you're in your 50s or 60s and afraid to move, start small. 5 minutes of daily mobility work is better than none. Motion is lotion. It heals from within. Misconception number 5. Joint replacement is inevitable. Joint replacement surgery has become common in the US, with over 1 million knee and hip replacements annually. But that doesn't mean it's the only future for people over 50 with pain. Many cases can be slowed, stabilized, or even reversed through early intervention. Research from the American Academy of Orthopedic Surgeons, AAOS, shows that strengthening surrounding muscles and adopting an anti-inflammatory lifestyle can delay or avoid surgery by up to 10 years. Advanced therapies such as platelet-rich plasma, PRP, or stem cell treatments can help regenerate damaged tissues in certain patients. The decision for surgery should come only after comprehensive lifestyle and medical approaches have been exhausted. Surgery replaces a joint, not the habits that damaged it. Your goal should always be preservation first, replacement last. Joint pain after 50 often begins quietly, with stiffness, fatigue, or small misconceptions. The greatest danger isn't the pain itself, but the delay in response. By understanding early warning signs and rejecting common myths, adults can prevent years of unnecessary suffering and stay active well into their 70s or 80s. Diagnosis and American standards of joint evaluation. The importance of early medical evaluation. Why waiting it out is risky. Many Americans over 50 delay seeing a doctor when joint pain begins, hoping it will resolve on its own. But the truth is, the longer you wait, the more irreversible the damage becomes. Cartilage, degeneration, and inflammatory processes often progress silently. Once cartilage is worn down, it cannot fully regenerate naturally, which is why early diagnosis is crucial. In the United States, orthopedic and rheumatology specialists follow the functional window approach, meaning treatment is most effective during the first few years of joint pain before major structural loss occurs. Yet according to the CDC, nearly 40% of arthritis cases are not diagnosed until moderate or severe damage is already visible on imaging. Delaying care not only increases pain, but also raises the risk of secondary complications like joint instability, muscle atrophy, and even mental health decline due to chronic pain. If you experience persistent stiffness lasting over 6 weeks, difficulty climbing stairs, or pain that interferes with sleep, these are your cues to seek medical evaluation immediately. Prevention starts with awareness, but protection starts with early, evidence-based diagnosis. Physical examination. What doctors look for when you visit a doctor for joint pain. The first step isn't high-tech, it's hands-on observation. An experienced physician can often tell a great deal just by watching you walk, sit, and move. In American clinical standards, the physical examination includes several key assessments. Range of motion, how far the joint can move in each direction. Crepitus, a crackling or grinding sound that indicates cartilage wear. Tenderness and warmth, signs of inflammation or infection. Swelling or deformity, visible markers of chronic stress or rheumatoid changes. Functional tests, standing up from a chair, walking stairs, or gripping objects. A detailed musculoskeletal assessment helps differentiate between mechanical pain, caused by movement or structure, and inflammatory pain, caused by immune activity. For instance, pain that worsens with activity but eases with rest often points to osteoarthritis, while pain that is worse in the morning and improves throughout the day may indicate rheumatoid arthritis. The exam may seem simple, but it's the foundation of accurate diagnosis. A good clinician doesn't just treat symptoms, they read the body like a map. Imaging tests, seeing beneath the surface. Once a physical exam raises suspicion of joint damage or disease, imaging studies are ordered to confirm the diagnosis and gauge severity. The American College of Radiology, ACR, recommends several gold standard imaging tools. X-rays, the most common and affordable test used to detect bone spurs, joint space narrowing, and alignment issues typical in osteoarthritis. Magnetic resonance imaging, MRI, provides detailed images of soft tissues, cartilage, tendons, ligaments, and synovial fluid. MRI can detect early cartilage thinning before symptoms become severe. Ultrasound, increasingly popular for evaluating joint inflammation in real time, especially in smaller joints of the hands and wrists. CT scans, used in complex cases, particularly for spinal or hip issues. In the US, radiologists and rheumatologists use a grading scale, Kellgren-Lawrence for osteoarthritis, for example, to determine disease stage from mild, grade 1, to severe, grade 4. But here's the key insight. Many patients with normal X-rays still experience pain, meaning inflammation can exist before structural damage is visible. That's why imaging must be paired with blood work and clinical context for a full picture. Blood tests, the inflammatory and autoimmune markers. When joint pain is persistent or widespread, blood tests become critical for distinguishing between osteoarthritis, autoimmune arthritis, gout, or metabolic inflammation. American doctors often order the following laboratory tests: C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. Both measure systemic inflammation. Elevated levels suggest active inflammation common in rheumatoid or psoriatic arthritis. Rheumatoid factor, RF, and anti-CCP antibodies, specific markers that help confirm autoimmune arthritis. Uric acid, high levels indicate gout, a metabolic form of arthritis caused by crystal buildup in the joints. ANA, anti-nuclear antibody, screens for autoimmune disorders that can affect joints, like lupus. Vitamin D and calcium. Deficiencies here can worsen bone and joint health. According to the NIH, combining imaging and blood tests increases diagnostic accuracy by up to 90%. This holistic approach ensures that treatment targets the true cause, whether it's mechanical wear, immune dysfunction, or nutritional deficiency. In American medicine, diagnosis isn't guesswork, it's a multi-layered investigation guided by evidence. The roles of functional and lifestyle assessments are beyond labs and scans. US specialists now integrate functional lifestyle assessments into joint pain diagnosis. These include gait and posture analysis to identify biomechanical stress points, body composition scans, DEXA, to evaluate fat-to-muscle ratios and bone density, activity and diet history to uncover lifestyle-driven inflammation, sleep and stress assessments since poor recovery worsens chronic pain. This modern whole-person approach, sometimes called integrative musculoskeletal medicine, reflects a major shift in American healthcare. Doctors no longer just ask, "Where does it hurt?" but also, "What's happening in your daily life that contributes to this?" For instance, a patient with knee arthritis might also have weak core muscles, poor ergonomics at work, and a diet high in sugar, all invisible causes of inflammation. Correcting these can improve outcomes as much as medication. As one Mayo Clinic orthopedic specialist put it, you can't treat the joint without treating the person who lives in it. That philosophy defines the new gold standard of diagnosis in American preventive medicine. The dangers of self-diagnosis and online misinformation. In the digital age, it's easy to Google every symptom, but that convenience comes at a cost. Self-diagnosis leads many people to delay or choose the wrong treatments. In joint pain cases, this can be disastrous. Taking the wrong supplements, overusing painkillers, or following unverified internet remedies can accelerate damage rather than heal it. For example, some Americans self-treat with joint detox products that claim to flush inflammation, yet contain unregulated herbs or high doses of diuretics. Others rely solely on collagen powders without addressing weight, sleep, or muscle imbalance, missing the root causes entirely. The FDA has repeatedly warned that dietary supplements are not substitutes for professional evaluation. Even natural products can interact with medications or worsen underlying diseases. Self-diagnosis also creates false reassurance. People think it's just stiffness until it's too late. True healing begins with proper medical partnership. Rheumatologists, physical therapists, and nutritionists working together. Information is power, but interpretation is wisdom. Without expert guidance, even good data can lead to bad outcomes. The American Diagnostic Timeline, how long it takes and what to expect. In the US, joint pain diagnosis typically follows a 3-phase timeline. Primary care evaluation. Weeks. Your family doctor performs initial physical exams and basic labs. Specialist referral. Weeks 4-8. If arthritis or chronic inflammation is suspected, you're referred to a rheumatologist or orthopedic specialist. Imaging and lab confirmation. 1-3 months. MRI, X-rays, or autoimmune panels confirm the type and stage of joint disease. This structured approach ensures accuracy, but delays can occur due to insurance approvals or specialist availability. The average American patient waits 6-12 weeks for a full diagnosis. During that time, lifestyle interventions, reducing processed foods, light exercise, stretching are strongly encouraged. For urgent cases, such as acute swelling, redness, or feverish joints, emergency evaluation is necessary, as these may signal infection or gout flare-ups. Understanding the diagnostic journey helps patients prepare mentally and financially. It's not a race. It's a stepwise path toward clarity and control over your long-term health. The emotional side of diagnosis, managing fear and uncertainty. Hearing the word arthritis or degeneration can trigger fear, especially for adults who equate it with disability. But diagnosis should be seen as empowerment, not defeat. Knowing what's happening allows you to act strategically instead of guessing blindly. In American health psychology, this mindset shift from fear to awareness has been shown to improve recovery outcomes. Patients who understand their diagnosis and participate actively in treatment through exercise, diet, and mental resilience experience 30 to 50% better function over time. It's natural to feel anxious, but remember, medical diagnosis doesn't define your destiny. It defines your starting point. Every positive change in movement, nutrition, sleep, and mindset builds upon that foundation. The best doctors don't just diagnose joints, they restore hope. Pain may be part of your story, but it never has to be the ending. Diagnosis is not just about finding what's wrong, it's about understanding why. The American standard of joint evaluation integrates science, imaging, and lifestyle insight to uncover the full story behind your pain. When approached early and intelligently, diagnosis becomes the first step toward lifelong joint preservation and freedom of movement. Prevention strategies after 50, protecting and strengthening aging joints. Nutrition, building anti-inflammatory foundations. What you eat every day either fuels inflammation or fights it. For people over 50, nutrition is the single most controllable factor affecting joint longevity. The standard American diet, rich in processed sugars, fried foods, and refined grains, triggers chronic low-grade inflammation known as metaflammation. This state silently destroys joint tissue and cartilage over time. To reverse that, adopt an anti-inflammatory eating pattern modeled after the Mediterranean or DASH diet, both backed by the Arthritis Foundation and Harvard Health. These diets emphasize fresh fruits and vegetables, especially leafy greens, berries, citrus, and cruciferous vegetables. Healthy fats from olive oil, avocados, and fatty fish like salmon or sardines. Whole grains, legumes, nuts, and seeds, all high in antioxidants and fiber. Reduced intake of red meat, sugar, and alcohol. Antioxidants, such as vitamin C, E, selenium, and polyphenols, help neutralize free radicals that damage collagen. Turmeric, curcumin, ginger, and green tea have clinically proven anti-inflammatory effects comparable to mild NSAIDs, without side effects. Food is not just fuel, it's medicine. A single week of improved eating can lower C-reactive protein, CRP levels, by up to 25%. Your grocery list is your first prescription for healthy joints. Exercise and mobility training, movement as medicine. Decades of research confirm that movement is the most powerful therapy for joint health. Contrary to the myth that exercise wears out joints, moderate movement nourishes them. Every time you move, synovial fluid circulates inside the joint capsule, delivering oxygen and nutrients to cartilage, which has no direct blood supply. The Centers for Disease Control and Prevention, CDC, recommends at least 150 minutes of moderate activity per week, combining aerobic, strength, and flexibility training. For adults over 50, the best exercises are low impact but joint stimulating. Walking or brisk walking, swimming or water aerobics reduces joint stress by 50 to 70%. Yoga, Tai Chi, or Pilates improves balance and flexibility. Strength training 2 to 3 times per week. Resistance training strengthens the muscles that stabilize joints, reducing load and friction. For knee and hip arthritis, leg presses, glute bridges, and resistance band work can dramatically improve mobility. Aging joints don't need rest. They need the right kind of motion. Start small, move daily, and remember, the goal is consistency, not intensity. As one Mayo Clinic expert says, motion is lotion, stagnation is rust. Weight management, reducing the load on your joints. Every extra pound of body weight adds approximately 4 pounds of pressure on the knees with each step. That means even a modest 10-pound weight loss can relieve 40 pounds of joint stress, a clinically significant reduction. For overweight adults over 50, managing body weight is among the top predictors of long-term joint health. Excess body fat does more than increase physical strain. It also acts as a metabolic factory of inflammation. Fat cells release adipokines, inflammatory molecules that accelerate cartilage breakdown and increase oxidative stress. In obese individuals, the risk of knee osteoarthritis is up to 4 times higher, according to the Johns Hopkins Arthritis Center. Sustainable weight control comes from gradual lifestyle change. Balanced portions, plate divided into half vegetables, 1/4 lean protein, 1/4 whole grains. Limit sugary beverages and processed snacks. Stay hydrated. Dehydration thickens synovial fluid and increases stiffness. Incorporate short, frequent walks, even 5 minutes after meals, helps regulate blood sugar and inflammation. Weight management is not about appearance. It's about preservation. The lighter your load, the longer your joints last. Posture, ergonomics, and daily mechanics. Poor posture and movement habits are silent contributors to joint pain, especially in modern America, where long hours of sitting are the norm. Slouching, leaning on one hip, or working at a misaligned desk can gradually distort joint alignment, particularly in the spine, shoulders, and knees. For adults over 50, maintaining ergonomic awareness is critical. The Occupational Safety and Health Administration, OSHA, and American Physical Therapy Association, APTA, recommend keep your workstation at eye level to reduce neck and shoulder tension. Use chairs with lumbar support. Keep feet flat on the floor. Avoid crossing legs for long periods. It strains the hips and knees. When lifting objects, bend at the knees, not the waist. Additionally, posture-correcting exercises like wall angels, planks, and chin tucks help realign the body. Even 10 minutes of daily posture practice can reduce spinal pressure and improve balance. Your posture is your framework. Every step, every sitting position, every bend either reinforces or damages your structural integrity. Treat daily movement as part of your therapy, because it is. Stress management and emotional wellness. It might surprise many, but stress is biochemical. It doesn't just affect your mood, it affects your joints. Chronic psychological stress raises cortisol levels, which in turn increases inflammatory cytokines throughout the body. Over time, this can worsen pain sensitivity, disrupt sleep, and slow tissue repair. Studies from the National Institutes of Health show that adults over 50 who report chronic stress have 40% higher inflammatory markers, CRP and IL-6, than those who manage stress effectively. Stress also encourages emotional eating, poor posture, and reduced physical activity, all worsening joint health. The solution is not just relaxation, but structured recovery. Practices like mindfulness meditation, deep breathing, gentle yoga, or nature walks help regulate cortisol and parasympathetic activity. Social connection also plays a protective role. Loneliness has been linked to increased systemic inflammation and faster functional decline. Your mental health and your joint health are part of the same system. A calm nervous system promotes healing and resilience. Peace of mind literally translates into ease of movement, sleep, and recovery. The nightly repair system. Sleep is the body's natural repair mechanism, and its absence is one of the most overlooked causes of chronic joint pain. During deep sleep, growth hormone and melatonin trigger tissue repair, reduce inflammation, and regenerate cartilage cells. Adults over 50 who sleep fewer than 6 hours per night have twice the rate of arthritis progression, according to a 2020 study in Sleep Health Journal. Poor sleep increases inflammatory cytokines like TNF-alpha and IL-1B, while decreasing pain tolerance. In other words, sleep deprivation both worsens inflammation and amplifies your perception of pain. To optimize recovery, maintain a consistent bedtime. 10 p.m., 6 a.m. is ideal. Avoid screens and caffeine 2 hours before bed. Keep your bedroom cool. 65 to 68 atagi 18-20 down. Use supportive mattresses and pillows to maintain spinal alignment. If chronic pain keeps you awake, techniques such as progressive muscle relaxation, magnesium glycinate supplements, or warm baths may help. Remember, the hours you sleep are the hours your joints heal. Rest is not a luxury, it's therapy. Smart supplementation. Science-backed nutrients for joint protection. Supplements are not magic pills, but strategic tools that support your body's repair processes. Among adults over 50, several nutrients have consistent evidence for improving joint comfort and slowing degeneration. Omega-3 fatty acids, fish oil, reduce joint swelling and morning stiffness by lowering inflammatory prostaglandins. Turmeric, curcumin, in clinical trials, 500 to 1,000 milligrams daily has shown effects comparable to ibuprofen for mild arthritis. Collagen, peptides, support cartilage repair and improve joint elasticity. Glucosamine and chondroitin sulfate help maintain cartilage thickness and delay osteoarthritis progression. Vitamin D3 plus K2, essential for calcium absorption and bone strength. Magnesium and zinc aid muscle relaxation and connective tissue health. However, quality matters. In the US, the FDA does not regulate supplements as strictly as prescription drugs, so always choose third-party tested brands, USP, NSF, or GMP certified. Consult your physician before combining supplements with medications, particularly blood thinners or steroids. Think of supplements as precision nutrition. They fill in the gaps your diet and lifestyle may leave behind, not replace healthy habits. The preventive mindset, from pain avoidance to joint longevity. Perhaps the most powerful prevention strategy is mental. Shifting from a reactive to a proactive mindset. Many adults over 50 focus on avoiding pain rather than building resilience. But prevention is not about escaping discomfort. It's about creating conditions for strength, stability, and independence. Joint longevity is a lifelong investment. The earlier you adopt habits that reduce inflammation, the more years of mobility you gain. Even if you already have arthritis, lifestyle changes can halt its progression and restore quality of life. In American geriatric medicine, this is called active aging. The philosophy that growing older should not mean growing weaker. It's about staying curious, moving daily, and viewing your body as an evolving system capable of repair. Your joints don't measure your age in years. They measure it in how you move, eat, and recover. Prevention begins today with every choice you make. Healthy joints after 50 are not a matter of luck or genetics. They are the result of daily decisions. Nutrition, movement, posture, stress control, sleep, and supplementation form the 6 pillars of lifelong joint protection. With consistent care, it's entirely possible to live pain-free, mobile, and strong well into your 80s and beyond. The modern American approach, from pain management to functional recovery. In the past, Joint pain treatment focused almost entirely on pain relief, using drugs to suppress symptoms. But today, modern American medicine has evolved toward a functional recovery model, emphasizing the restoration of movement, balance, and long-term prevention. This approach is called comprehensive joint care. It integrates medical, physical, and lifestyle therapies into one personalized plan. According to the Mayo Clinic and American College of Rheumatology, the best treatment is not the strongest pill, but the right combination of early intervention, lifestyle correction, and targeted therapy. The goals are reduce inflammation and pain, protect existing cartilage, and prevent further degeneration. Restore mobility, balance, and strength. Improve overall quality of life and independence. This requires a multidisciplinary team, physicians, physical therapists, dietitians, and sometimes psychologists working together. It's not about masking pain. It's about reclaiming function. When treatment focuses on recovery rather than relief, healing becomes sustainable. Conventional medical treatments, the evidence-based backbone. The first line of treatment for moderate joint pain often includes non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen. These reduce inflammation and provide temporary relief. For many older adults, they help break the pain cycle long enough to begin physical therapy. However, prolonged NSAID use can now cause gastrointestinal bleeding or kidney issues, especially in adults over 60, which is why doctors emphasize careful monitoring. Other standard medical options include topical analgesics, creams or gels containing diclofenac or capsaicin, offering localized relief with fewer side effects. Corticosteroid injections, fast-acting inflammation reducers, often used for knees or shoulders. Effective for short-term flares, but should not be repeated excessively, as they may weaken cartilage over time. Hyaluronic acid injections, sometimes called joint lubricants. These improve viscosity in the joint capsule and can relieve stiffness for several months. In severe cases, joint replacement surgery, hip or knee arthroplasty, remains a highly successful solution, restoring function in over 90% of cases when performed by experienced surgeons. Yet it's seen as a last resort after conservative measures fail. Medicine's goal is not just to silence pain, but to create a therapeutic window, allowing rehabilitation and lifestyle change to take effect. Physical therapy and rehabilitation. Rebuilding from the ground up, physical therapy, or PT, is the cornerstone of modern recovery. In the US, PT is prescribed in nearly every arthritis or post-surgery case because it retrains the body to move efficiently, strengthen weak muscles, and protect damaged joints from future strain. A licensed physical therapist begins with an assessment of gait, muscle strength, flexibility, and balance. Then, a tailored program is created, including range of motion exercises to reduce stiffness, strengthening routines for key stabilizing muscles, glutes, quads, core, neuromuscular retraining to correct imbalances or poor movement patterns, manual therapy to relieve tension and improve tissue elasticity, hydrotherapy, exercise in warm water for low-impact joint support. The American Physical Therapy Association, APTA, reports that consistent PT can reduce pain and improve joint function by up to 60% without surgery. Moreover, patients who combine PT with lifestyle modifications, like weight control and nutrition, sustain benefits much longer. Recovery is not passive. It's built through daily engagement. Movement, guided by expertise, is both therapy and prevention. Advanced and regenerative therapies, PRP, stem cells, and beyond. In the last decade, regenerative medicine has transformed the field of joint care in the US. These treatments don't just manage pain. They aim to stimulate natural repair mechanisms. 1. Platelet-rich plasma, PRP therapy. PRP uses your own blood, concentrated to extract platelets rich in growth factors. When injected into damaged joints, these factors promote tissue repair, reduce inflammation, and improve pain. Studies from Stanford University show PRP can provide lasting improvement in early to moderate osteoarthritis, sometimes delaying surgery for years. 2. Stem cell therapy. Derived from bone marrow or adipose tissue, stem cells can differentiate into cartilage-like cells. Though still under study, results are promising for cartilage regeneration. The FDA currently allows only autologous, self-derived stem cell treatments, and ongoing trials are refining dosage and technique. 3. Laser and shockwave therapy. Low-level laser therapy, LLT, and extracorporeal shockwave therapy, ESWT, help stimulate blood flow, reduce inflammation, and accelerate recovery. While not replacements for medical treatment, they are valuable adjuncts, particularly for chronic tendon and ligament pain. Regenerative therapies are not miracle cures. They're advanced tools in a comprehensive plan. Their success depends on proper patient selection, experienced clinicians, and a foundation of healthy lifestyle habits. Integrative and natural medicine, bridging East and West. An increasing number of American clinics now practice integrative medicine, combining conventional science with natural therapies. The goal is not to reject Western medicine, but to enhance it, aligning biological and lifestyle healing. Common integrative approaches include acupuncture, stimulates blood flow, releases endorphins, and reduces pain perception. NIH trials show measurable benefits for knee arthritis and chronic back pain. Massage therapy and myofascial release improve circulation and reduce muscular tension surrounding inflamed joints. Herbal support, turmeric, boswellia, ashwagandha, and devil's claw have anti-inflammatory properties validated by multiple studies. Mind-body practices, yoga, qigong, and meditation reduce cortisol and enhance body awareness, leading to long-term improvements in mobility and pain tolerance. At leading institutions like Cleveland Clinic's Center for Integrative Medicine, patients follow personalized protocols combining nutrition, acupuncture, and PT. The result is a more holistic recovery, treating both body and mind. When East meets West, healing becomes complete, restoring not only movement, but also harmony. Post-surgery and long-term rehabilitation. The road back to function for patients who undergo joint replacement or reconstructive surgery. Rehabilitation determines success. The surgery fixes the structure, but the recovery process restores function. In the US, post-operative care follows a strict protocol, typically divided into 3 phases. Early phase, weeks 1-4. Controlled mobility begins almost immediately after surgery to prevent stiffness and blood clots. Strength phase, weeks 4-12. Gradual reactivation of muscles through guided PT, balance training, and pain management. Maintenance phase, months, 3-12. Focus shifts to endurance, gait correction, and confidence in daily movements. Patients who adhere to full rehab programs regain up to 90 to 95% of pre-pain mobility within 1 year. Neglecting rehabilitation, however, can lead to scar tissue, weakness, and new imbalances, sometimes worse than before surgery. Recovery doesn't end when the incision heals. It ends when you regain freedom of motion, and that takes dedication beyond the operating room. Personalized treatment pathways. One size never fits all. One of the biggest advances in joint medicine is personalization. No two patients experience the same kind of joint pain, even with the same diagnosis. Age, genetics, weight, hormonal balance, stress, and the lifestyle all shape the disease differently. That's why American specialists use personalized treatment maps, combining objective data, imaging, lab results, functional analysis, mobility tests, gait metrics, patient goals, sports return, pain-free walking, active retirement. For example, a 52-year-old office worker with mild arthritis might thrive on weight training and diet adjustment, while a 68-year-old retiree may benefit more from aquatic therapy and collagen supplementation. Technology now allows clinicians to use AI-assisted motion tracking, digital rehab apps, and remote monitoring, helping older adults recover safely at home. Treatment success depends on alignment between medical science and personal commitment. You are not a passive patient. You're a partner in your own recovery. The psychological aspect of recovery, healing the mind. To heal the body, pain affects more than the body. It affects self-esteem, mood, and identity. Many older adults fear becoming a burden when joint pain limits independence. This emotional burden can actually slow physical recovery. Research from the American Journal of Geriatric Psychiatry reveals that patients who develop depression after a joint diagnosis experience slower functional recovery and higher inflammation markers. The body follows the mind. That's why top rehabilitation programs now include psychological counseling, group classes, and mindfulness training as part of recovery. Support networks, whether family, friends, or arthritis, support groups dramatically improve adherence to therapy. Optimism isn't naive, it's biochemical. Positive emotional states increase endorphin production, enhance circulation, and lower cortisol, creating the perfect environment for healing. The most advanced treatment plan fails without hope. The simplest plan succeeds with it. Modern American joint care is not about quick fixes. It's about combining science, rehabilitation, and mindset into one integrated journey. From medical treatments and physical therapy to regenerative and natural medicine. Recovery becomes possible when you commit to consistency, discipline, and belief in your body's ability to heal. Golden habits for pain-free aging. Everyday routines that keep you moving. Morning mobility rituals. Start the day by oiling your joints. How you move in the first 15 minutes after waking sets the tone for your entire day. Overnight, synovial fluid thickens, circulation slows, and joints stiffen, especially in adults over 50. That's why establishing a gentle morning mobility ritual is one of the simplest yet most effective longevity habits. Begin with hydration. Drink a full glass of water before you even get out of bed. Dehydrated cartilage rubs instead of glides. Then spend 5 to 10 minutes performing low-impact movements, ankle circles, shoulder rolls, gentle spinal twists, or seated leg lifts. These stimulate blood flow and distribute synovial fluid evenly across the joints. The Arthritis Foundation found that people who engage in light morning movement report up to 40% less stiffness throughout the day. Pair your routine with calm breathing or soft stretching music. This lowers cortisol and relaxes muscles before they tighten. Consistency matters more than intensity. Even if you move slowly, do it daily. Your joints remember motion like language. Use it every morning, and you'll stay fluent in movement for decades. Anti-inflammatory daily nutrition. Eating to stay mobile. Food is your most powerful daily medicine. Every bite you take either promotes inflammation or prevents it. For adults over 50, joint longevity begins on the plate. Aim for a colorful diet, literally. The deeper the color, the higher the antioxidant power. Include blue and purple berries for anthocyanins, natural anti-inflammatories. Leafy greens like spinach and kale for magnesium and vitamin K, fatty fish, salmon, sardines, mackerel for omega-3s that lubricate joints. Nuts and seeds for zinc, selenium, and healthy fats. Limit red meat, fried foods, and refined sugar, all of which trigger inflammatory cytokines. Replace them with plant-based proteins, lentils, tofu, or tempeh. Researchers at Harvard Health report that adherence to a Mediterranean-style diet can reduce arthritis symptoms by up to 70% in some individuals. The key is consistency. Nutrition doesn't work in one meal. It works over time, reshaping your body's chemistry day by day. Think of your kitchen as your first pharmacy and your fork as your prescription. Hydration, sunlight, and movement breaks. Micro habits for joint longevity. Small habits create long-term transformation. 3 of the simplest, hydration, sunlight, and micro movement, are often overlooked, yet profoundly powerful. Hydration. Cartilage is up to 80% water. When you're dehydrated, it becomes brittle and prone to friction. Adults over 50 should aim for 2 to 2.5 liters of water per day, more in hot climates. Add electrolytes or lemon to enhance absorption. Sunlight. Just 15 minutes of morning sun boosts vitamin D production, essential for calcium absorption and bone strength. Low vitamin D levels are linked to faster arthritis progression. Movement breaks. The human body was not designed for prolonged sitting. Set a timer to stand, stretch, or walk every 30 to 45 minutes. Even a 1-minute movement snack, rotating wrists, rolling shoulders, flexing ankles, keeps blood and synovial fluid flowing. These micro habits cost nothing but yield enormous returns. They are the quiet defenders of your joints, protecting you hour by hour. Smart supplement routine. Timing matters as much as choice. Supplements can be powerful allies when used intelligently, yet many adults take them inconsistently or at the wrong times. To maximize benefit, follow a structured supplement routine that aligns with your body's rhythm. Morning. Take omega-3s, vitamin D3 plus K2, and magnesium with breakfast. These work synergistically to support bone density and reduce inflammation. Midday, collagen peptides, or glucosamine, chondroitin, are best absorbed with protein-rich meals. Pair them with vitamin C to enhance synthesis. Evening. Anti-inflammatory botanicals such as curcumin or boswellia help lower nighttime pain and improve sleep quality. Always buy third-party tested supplements, USP, NSF, or GMP certified. Cheap, unverified brands may contain fillers or heavy metals that harm your liver or kidneys. According to the National Institutes of Health, consistent supplementation over 3-6 months is required before measurable improvement appears. Patience and precision are the rules, not instant gratification. The smartest supplement is the one you take correctly, not the one you buy impulsively.